and I'm going to talk about lymphedema. Hello friends, my name is Dr. Pradeep. Its causes, symptomatology and how we diagnose it, and what are the treatment options which are available to help these patients who are having lymphedema. Basically, there is a parallel lymphatic system in our body which carries the extracellular fluid rich in protein from the extremities to the center of the body towards the vascular system. So this parallel system is called the lymphatic system. So whenever there is a stasis in the lymphatic fluid and there is a problem in the lymphatic system, so patient get the lymphedema. That is the edema of the extremity, whether it could be hands or could be foot or leg. Patients have initial stage, patient have little puffiness of the hand, puffiness of the foot. Slowly, gradually, it hardens, and there are few skin changes also after sometimes if it is not cured or if it is not timely managed. So what are the causes of lymphedema? Lymphedema can be categorized into two groups, basically primary lymphedema and secondary lymphedema. Primary lymphedema, when there is an inherent problem with the lymphatic system from the birth itself. So it could be congenital lymphedema, it could be adolescent lymphedema, which is called lymphedema tarda, or it could be adult lymphedema. Secondary lymphedema is because of some insult to the lymphatic system after the birth. So it could be because of any trauma, it could be because of any cancer surgery, or it could be because of the cancer of the region where the lymphatic channels are present or lymph node stations are there. So these are the basic causes of lymphedema. So what are the symptomatology of the lymphedema patients, how they present to our clinic, how they do go about it. So basically, initial stage, patient experience the puffiness of the limbs, could be hands or could be foot. Slowly, they also experience some pain, some skin changes. In long-standing cases, there are a lot of patient gets elephantiasis also. The limb girth becomes so much that they're not able to move their limb, not able to walk, not able to do any general activity. So that's how the lymphedema patient present to our clinic. Now, when we talk about the diagnostic methods, so basically it's a clinical issue. We just see the patient and we know that the patient is having lymphedema. The initial stage it is pitting, but in the long-standing cases it is non-pitting edema with lots of skin changes. When we talk about the treatment option and the management of these patients, specifically the surgical management, then we do the lymphoscintigraphy and lymphangiography to assess the position of the lymphatics and the lymphatic channel, that is the lymph nodes. So we do the lymphangiography. We have the lymphangiography facility in our hospital where we inject the dye in the web space of the fingers or the toes, and we see and we scan with the gamma camera and see the status of the lymphatics, whether they are intact or not, or there is a dilatation of the lymphatic channels. So that's how we diagnose and that's how we plan the patient for the surgery, if the surgery is required. Now, when we talk about the management of the lymphedema patient, we divide it into two phases. One is the conservative management and another is the surgical management. Surgical management is further in two stages, which I'll talk about later. First, we come to the conservative management. When after the lymphangiography, we found that the lymphatic vessels are intact and lymphatic basins, which are also called the lymph nodes, they are also intact, and it is then we know that it's a temporary phase of the edema. So it can be very well relieved with the help of the conservative management, which has three stages, three part of the conservative management. First, we do the manual drainage of the extremity. Then we do the triple bandaging and the limb elevation. So these are the main three steps for the conservative management of the lymphedema. Initial stages of the lymphedema can be very well managed by the conservative treatment. This problem gets chronic and we know that there is a certain blockage of the lymphatic vessels and the lymph node stations. Then only the surgical options are left. Whenever there is a failure of conservative management, we offer the surgical treatment. Surgical treatment is divided into two phases. One is the physiological surgical treatment. Second is the excisional procedures. Physiological procedures, we bypass the lymphatic channels or we provide the new lymph node basin which are there in other part of the extremities. That means we do the free vascularized lymph node transfer and lymphovenous anastomosis we do. What we do in lymphovenous anastomosis, when we found that there are lymphatics which are intact, we anastomose those lymphatics with the venous channels. So the lymphatic system gets bypassed through the veins. So we bypass the blocked area and the lymph tend to get flow through the venous system. So that's how we do the lymphatic channels. When we see there are no lymphatic vessels, intact lymphatic vessels on lymphangiography, then we do the free vascularized lymph node where we take the lymph nodes along with its vascular supply from the other part of the body. Most common sites are the axillary lymph nodes or the supraclavicular lymph nodes. We take those lymph nodes along with the vascular supply and we implant those lymph nodes in the extremity. In lower extremity, we implant them at the ankle area. We do the vascular anastomosis and we presume that there is going to be some lymphogenesis. When there are no intact lymphatic vessels are present on the lymphangiography, then we do the free vascularized lymph node transfer where we transfer the lymph nodes along with its vessels from the other part of the body. Most common sites are the supraclavicular lymph nodes and the axillary lymph nodes. We transfer those lymph nodes into the ankle in case of lower extremity, in the wrist in case of upper extremity, and we anastomose the blood vessels of that area, hoping that there is going to be some lymphogenesis and production of the efferent and afferent lymphatics, which helps the edema to subside and to drain the whatever edema is there on their extremity. So that's how we do the surgical management. Once we do the surgical management, there is a time period. We ask the patient to do the extensive physiotherapy and extensive conservative management for at least 6 months, so that the lymphatic channels they start working again and they are opened up and patient experience the lymphedema to subside. So these are the management steps of the lymphedema. Thank you very much.